My name is Dr. Daniel Fox, and I'm a licensed psychologist in the state of Texas and an expert in the area of personality disorders. And today I wanted to talk about shame and borderline personality disorder, specifically the two types of shame. Now, the first type, we can call that just the generic or what most people think of as shame. Now, this is that painful feeling of humiliation or distress that is caused by a recognition or awareness that you've done something wrong or mistaken behavior. And this is something that's usually temporary, tends not to last very long, and very rarely is it internalized. Now, the other type of shame that we're going to spend much more time talking about and discussing, and also I'm going to give you some suggestions and tips that can help you manage this type of shame should you have this experience. It's called toxic shame. And toxic shame is a long-standing shame that kind of bleeds into how you see yourself, others, and situations. And this is the type of shame that is common in a lot of individuals along the borderline personality spectrum, as well as those with borderline personality disorder. So when we talk about shame and borderline personality disorder, we're talking about actually in the criteria in the Diagnostic and Statistical Manual, the 5th edition, the most recent one, that it actually talks about or alludes to the concept of shame, which is built into the conceptualization and process of diagnosing borderline personality disorder. And what it says is that individuals with this disorder being borderline personality disorder, frequently experience inappropriate, intense anger, or they have difficulty controlling their anger. And where does the shame come in? That's talking more about anger than shame. Well, where it comes from is that this expression of anger is often followed by shame and guilt and contributes to the feeling they have of being evil, broken, misunderstood, etc. So this sense of anger, this component, this criteria of anger, is sort of this trigger or springboard to other aspects that can trigger a shame response. And it's that toxic shame that lays underneath a lot of those folks for borderline personality disorder. And there's been some research that's been done on borderline personality disorder and shame as well. And I just want to talk to you a little bit about it now, which I think helps to conceptualize and also to recognize that if you are along the borderline spectrum, and if you do have borderline personality disorder, toxic shame is not an uncommon experience. So you're not alone in having this experience. So I want to normalize that experience so that you don't exacerbate those feelings of shame and saying, well, you know, I not only am I borderline, but I carry this sense of shame in the way you define it and carry it with you. That a lot of folks that are along the borderline spectrum and that have borderline personality disorder also have and possess this toxic shame. So what research has shown us is that those with borderline personality disorder, that they report higher levels of shame and guilt proneness, state shame. And what state shame is that that's when you're in a particular state, in a particular sense of feeling or reaction or situation, that you tend to be prone, you're at a higher likelihood to pick up on shame identifiers, shame triggers, and that can trigger this long, what's called a shame spiral. And I may do a video on just shame spirals later on, but that can trigger this shame reaction. So it's that toxic shame that sits there. You're in this situation, right? That maybe someone says something, someone does something, your expectations aren't met, things don't follow through the way you expected. And then you fall into this shame reaction, okay? So, and then also out of that shame reaction, right, we also have that there's this anxiety as well. So we know that folks with borderline personality disorder, the research shows that they have higher levels of shame and guilt. They're prone to that shame and guilt. It is state shame as well. And what I'm talking about is we could say it's more of a trait, which is toxic shame, a trait shame. And that would be that we see it's connected to borderline personality disorder. So there's state, which is based on particular situations that you're in and reactions that you may have, but a trait is something that you carry with you, okay? And then, of course, anxiety as well. So what we see is that shame proneness was negatively correlated with self-esteem and perceived quality of life. So what we see is that shame proneness, right? So that higher likelihood of feeling that sense of shame, the people that have higher that have lower self-esteem and perceived quality of life. And that kind of makes sense, right? That kind of fits into how a lot of folks, particularly with borderline personality disorder, kind of conceptualize their world. Is that shame, I'm high on shame because, and we carry this toxic shame with us because it's long-standing, it impacts how we see ourselves, others, and situations. So we carry it with us. And that sort of keeps our self-esteem at a lower level, kind of holds it down. It's put like a cap on it. Imagine like a sewer, and that sewer cover. And that sewer cover is so heavy. I don't know if you ever tried to pick one of those up. When I was a kid, I would try to pick those up. And they're really, really heavy. And so it's one of those heavy things that keeps that self-esteem as well as recognition of quality of life low. Now there's additional research, okay, that also shows that elevated levels of borderline features. So these are characteristics, these are qualities of borderline personality disorder, that these folks reported higher levels of self-blame and shame. So what do these two research studies tell us? What they tell us is that individuals with borderline personality disorder, as well as those that are along the borderline spectrum, they may not meet criteria for the full disorder, but they have those traits, right, those components that make up borderline personality disorder, that they are at a higher likelihood for shame. And in this video, we're calling it toxic shame, because we're saying that these individuals carry this sense of shame with them. Now, let me just clarify. Is it possible that individuals with borderline personality disorder don't have toxic shame? Absolutely. Absolutely, because when I work with folks that have borderline personality disorder along that borderline spectrum, I don't just start stamping them. I want to see what components are there, what core structure and what core issues are present, so we can work with the individual and not neglect the conceptualization of the individual and only treat the disorder. Because if you just treat the disorder, you lose the component of the individual, which who are we working with when we're working with folks? The individual. So, and if that's confusing, I'll try to clarify just real quick, in that we have to recognize the specific characteristics, criteria, presentation, okay, for that individual that has borderline personality disorder, and not all of a sudden see them as a global individual, just this person. Oh, well, that's a borderline person, okay? And as I've said in other videos, and I say in all my seminars, that I never define people by their diagnosis, okay? That it's always about a recognition that the individual is present who has these particular issues, and they may meet criteria for borderline personality disorder. So never lose focus of that individual, okay? So let's go on. So what is the impact of toxic shame? So toxic shame creates a lot of fear and doubt, okay? And that is often intensified, so you carry that with you, okay? You blame yourself much quicker. You're very quick to self-blame. You're very quick to take the brunt, the hard edge of a lot of issues. Without much evidence, you won't explore contrary evidence to say, wait, maybe I wasn't at fault here. Maybe it's not all my fault. There's other players. Because instead, toxic shame tells you it's all you. It's all your fault. Because you're broken, you're not good, you're unnecessary, whatever those components are, okay? It erodes your sense of self-worth and self-efficacy, how you see yourself, what you're able to do. So it works these things away, it wears them down. It also leads to that tendency to see yourself as inadequate, broken, different, and this goes back to that criteria for borderline personality disorder that we talked about, that is in that diagnostic and statistical manual. So it goes back to that particular one, that toxic shame is related to that component, okay? Now, you also feel like you're more likely to be misunderstood yourself, and because of toxic shame, you are more likely to misunderstand yourself, others, and situations due to this, what's called a toxic fear or toxic shame distortion, okay? You have trouble communicating effectively, saying what you mean out of fear of being seen as stupid, inadequate, inferior. So you put this presentation of a false self forward because you try to contain your sense of toxic shame. And And it also can lead to what's called impaired empathy. And this results due to that toxic shame distortion that I mentioned. And in some of the other videos that I've mentioned, as well as a book I have coming out and other issues and what I've worked with individuals, is we have this thing, it's called Bpd Lens. Now I could also do a video on this if folks are interested, and just let me know in the comments. But what a Bpd lens is, and it is that borderline personality disorder creates a distortion. So you're not seeing the world as it is, you're seeing the world through your borderline personality disorder lens. And that distorts the reality, that distorts who you are in your interactions in the world around you. Okay? But it also, because of that distortion, promotes or continues your borderline personality disorder, because you end up indirectly or sometimes directly reinforcing that borderline personality disorder. Okay? Now it's a really complex discussion, is something that we can certainly talk about in another video if people tell me they're interested. But what I want to talk about is that toxic shame distortion, which is very similar to that Bpd lens. And as you see things not as they are, but you see them as a way to protect yourself and create distance from others. So you isolate physically, emotionally, or both. Okay? So all of these things that impact us from toxic shame, well, where does it come from? Well, when we look at the roots of toxic shame and what has bred it over time, is that a lot of times it's from adverse experiences, such as in childhood, adverse experiences in childhood, such can be physical, emotional, or sexual abuse. It can also come out of growing up in a household where they hold the idea that you can make someone feel bad enough to do good things. Now think about that, right? So can you make someone feel bad enough to do good things? So sometimes we feel like it's this misaligned idea that if I make you feel bad enough about yourself, you'll then rise to the challenge. The reality is, from certainly my experience and working with a lot of these different folks, is that when you make someone feel bad enough about who they are, they tend to feel bad enough about who they are. And that makes it much more difficult to rise to the occasion. And instead, we find that encouraging those folks, building those folks, empowering those folks is what helps them rise to the occasion. So sometimes when we grow up in our home environments, our family of origin in some cases, that we hold this idea about making you feel bad enough to do good things, and that is where that toxic shame sort of originates. And then lastly is that it's a family value. And that family value, it's passed down, this toxic shame is passed down from generations about how inadequate, unimportant you are, which is supposed to make you feel love-worthy. So when I'm humble enough, I'll be love-worthy. But what happens is that when you feel humble enough and you are shamed growing up, and you internalize it, and it becomes this toxic shame, what happens is that you start to question your love-worthiness, right? How important am I? What more do I have to do for someone to accept me? And because those are ill-defined, they're not clear, you never know when you reach that mark, so it's constantly uncertain. You're constantly driving for something you're unsure of. And that creates a lot of problems, particularly if you're on a developmental trajectory for borderline personality disorder. Okay? So now that we've talked about toxic shame, but what can you do to reduce it, right? Well, this is the important stuff. Now that we know what it is and you're able to identify it, well, how do you reduce it? Well, with my clients, I like to do a lot of visualization. I think, I had a client a long time ago, over 15 years ago, and I remember him telling me that, we don't do anything without thinking about it or seeing it in our head first. And that really stuck with me, because I was like, that's true. Even though that thought may be an instant, there's something, a picture, a thought, some type of thought process that's in there. Sometimes we have stimulus and reaction that's so fast we don't realize that there's that in-between component. And that's kind of where therapy is. Therapy is that in-between component that sometimes when folks see me, it's like this. And what we want to do is we want to get in there and sort of stretch that out. Okay. So what do? How do we reduce and start to heal from toxic shame? Okay, well, the first thing, again, goes back to what I'm talking about, is using imagery. Sometimes I'll ask my clients, I want you to do is to imagine a hot air balloon or a backpack, and I want you to put components of shame in the hot air balloon, or the backpack. These could be words you say to yourself. These could be images that you have that make you feel bad about who you are, that make you carry on to believe that you're not worthy of love and attention and respect and all of these different things, all the doubt that you have. And you're going to put it in this hot air balloon or this backpack. And if it's a hot air balloon, I want you to light it up, right? Because you know, hot air balloon, they have that fire, and let it go and float it off. And out it goes. And if you have a backpack and you filled it with all that and it's really heavy because toxic shame carries a lot of weight, I want you to take it off. I want you to imagine yourself going to a cliff and you're going to chuck it over the side. Okay? And what happens is that sometimes that doesn't just get rid of it, right? It's not magical. This is imagery. Imagery requires practice. It requires practice and practice. And I want you to keep doing that because your hot air balloon might blow back. And if it does, I want you to blow it back out. If that backpack appears on your back, I want you to imagine you're back at that cliff and you're chucking it off that cliff. Okay? So that's one thing you can do. You can use imagery. Okay? Now, you can also explore the roots of your toxic shame, where it came from, okay? What signals you feel when it's present, and then counter those signals, right, with positive affirmations and deeds that make you feel good, noticed, healthy, and valued. Right? Because shame doesn't want you to do good things. Toxic shame does not want you to do good things for yourself, does not want you to be patient, does not want you to be shy, does not want you to shine, excuse me, right? It doesn't want you to do those things. It wants you to feel bad about yourself. It wants you to hang on tight, right, to that borderline personality disorder. Okay? And it wants to keep you, remember, it keeps you with that sewer cover, keeps you underneath, right? That self-esteem, that seeing your quality of life and things of that nature. So it keeps those things down. Okay? So again, explore those roots. What are they? Where do they come from? Okay? And then you want to counter those, right? If it's that you're no good, think about things that you do that are good. Maybe you're patient. Maybe it can be something that, like, I'm a big hold the door open for people. I think that that's a common courtesy. I'm a big, I also wave on the highway. I think more thank you waves would be great. So I'm a big thank you wave driver, but I think it's those things, but feel good about those things. I mean, you know, I try to be polite. I try to, you know, care for folks, and, you know, you can do those things. Okay. So those count as good components, things that make you feel good about who you are. Next, what we want to do is we want to build boundaries against toxic shame. Well, how do we do that? So what I want you to do is, I want you to define what you'll tolerate and what you won't. What are some things that, yeah, I would tolerate this? What are some things, no way, that's just, I would not tolerate this. Okay, and you can start at extremes and then go down if you want, or you can start down things that you're like, yeah, you know, these are things I think I wouldn't, I'm not sure, and then build up, right, to explore that toxic shame so you can manage it and deal with it better. Okay, because when you identify, right, and that some of this goes back to those shame signals that we just talked about, which is signals that you're starting to kick off this sense of toxic shame. Okay, and so you want to be able to build those boundaries so that you can refute them, you can challenge them, remove yourself for a situation, right, and then be patient and caring with yourself. That's so important. Toxic shame doesn't want you to do that, but you need to do that. You need to take care of yourself, be kind and patient to yourself. That's so critical. Toxic shame doesn't want you to do that. It wants you to think that you have no value and nobody cares, but that's not the reality. Okay? And then lastly, I want you to do things that make you feel good about who you are and where you are in the world. Okay? And again, that goes back to sort of exploring the things that are important to you, things that have value to you. I've had a lot of clients who gain a lot of sense of self, a sense of positive sense of self by volunteering their time, by whether it's at an animal shelter or a soup kitchen sometimes, or whatever it may be. If they have the time, if they're able to do that, and sometimes it's just acts of kindness. So there's different things that make them feel good. And I hope that out of all this video, that the thing that you remember is that toxic shame can be a component of borderline personality disorder, but you can lessen it. You can heal from it over time. It's something that requires practice and skill. Just as toxic shame over your development became a skill, it's time to unlearn that skill and lessen that impact of toxic shame. And you can totally do that. You can. I've seen it with my clients. And I hope this video was helpful for you. Thank you very much for your time and attention. And please take care. Be well. Thanks.